The following podcast is taken from a live broadcast on Inspire FM. Ya hala, ya hala, ya hala, ya hala, ya hala.
Assalamu alaikum everyone, and welcome to Sister Speak. Today you're joined with me, Lamisa.
Me, Fadeen.
Me, Badriyah. And me, Mariam.
Yeah, so I was going to introduce our guest, Badriyah, today. Today we're joined by a very special guest. Her name's Badriyah Islam. She's from MAR. So MAR is a grassroots organisation which is supporting, healthcare access in resource-poor settings for pregnant women. And Badriyah is a fundraising officer there and a second-year medical student at Imperial College London. So thank you very much for joining us for today's show. So Badriyah is going to help us discuss today's main topic, which is surrounding disparities in healthcare and sustainable ways that we might be able to bridge those gaps. But before we get into everything, for people who may be listening to our show for the first time, Mariam, do you want to let everyone know what our show's about?
Absolutely. So just a warm welcome to Badriyah. So our show is a platform for Muslim girls to voice their own opinions on current events and issues, and even form discussions on general topics such as religion, culture, politics and identity. Please note that all opinions and views are our own and respect all other opposing views.
Yeah. And if they do want to get in contact with any of the topics that we discussed today, or just want to say their thoughts for the week, when we have that section, Fareen, where can they get in contact with us?
You can call us on 01582481822, or you can WhatsApp us on 07779 481 We're also live on Facebook at Inspire FM Luton, and you can also let us know your thoughts at Instagram at sistersspeak.
Yeah, exactly. So we'd love to hear your thoughts. Please do get in contact. And yeah, I guess that moves us on to the first segment of the show. So this is called Thought for the Week, where we just, as the name suggests, say a thought from the week. So we're going to go with Mariam first.
Oh, she's going to look at me.
I'm hosting today.
She feels like that. She usually thinks I pick on her, but whatever.
Yeah. Go on, Mariam.
So I think my thought of the week is about compounding habits. I know I talk about Atomic Habits a lot.
Atomic Habits.
But it's a great book, just by James Clear, for anyone that does want to read it. And I was just thinking about the concept of trying to do small things consistently. So the concept of doing something like, for example, sleeping early, for example. If you sleep 5 minutes earlier than you usually do, and you do that every single day, that's going to compound to a good habit throughout the year. So I feel like this is something that I really want to include, especially in the lead up to Ramadan, and how I want to incorporate small little habits that will help me sustain a good routine after Ramadan as well. So that's kind of my thought of the week.
That's a great piece of advice for all of us. I feel like a lot of people get scared to almost start making new habits because it seems like such a big thing to do. But your little trick of compounding habits, doing little things every single day will help it go easier. Fareen, do you want to go next?
Yeah, wait, I'm just going to talk about Mariam's one, because like I said last time, how small steps, they go a long way, and being consistent with your habits is really important. So thank you for that, Mariam. My thought of the week is a bit about patience. I think that sometimes we're so eager to do stuff, and we kind of don't wait. I feel like, I don't know if it's a skill, it's just a trait that's really important to have. You need to have patience everywhere, when you're driving, when you go to a shop, for example. When you go, I don't drive, but I just see my parents yelling at each other because of road rage and stuff. Even when you go to a shop and the cashier doesn't speak your language, you just have to be patient and understand that we're all human.
Very good lessons.
Thank you.
Do you want me to go first, and then we can come to you, Badriyah?
Yeah, go on.
Okay, so my thought for the week this week is about gratitude. I feel like if we have gratitude for everything that we have been given, it helps put things into perspective, but I think also brings back motivation and renews intentions as well. I feel like sometimes when you're doing something for a very long time, it can get easy to forget why you started that thing in the first place. And sometimes the fun gets sucked out of that thing as well. So if you think about where you're at and perhaps where you were 5 or 6 years ago or 10 years ago, and maybe what that person would have wanted back then, it kind of helps you to be a bit more grateful for what you have in the moment, and kind of renew that intention, which can help keep you going in the long run. So that's my thought for the week. Have a bit of gratitude if you can.
I feel like from a religious perspective as well, that we believe that if you're grateful, Allah gives you more.
Definitely.
And especially in recent circumstances that we've seen what's happening in Syria and Turkey, it's just really heartbreaking. And I think we should be really grateful that we are not amongst all of that. And I feel like we've been given so many privileges, and these people, they perhaps had the same privileges as us, but now it's been all wiped away. So it really does bring it back home to think about, okay, I think we should be more specific in our gratitude. So in terms of, what we have today, what we have in this present time. And because we're often always thinking about, okay, what's next and what I want more, because society is in a way that we've kind of succumbed to our desires, and nothing is satisfactory. So I feel like it's really important to have gratitude for even the smallest things. Like my thought of the week is compounding. When you're gratitude for small things, it's just going to create a habit of being gratitude in a fulfilling way.
Yeah. And I think that's true, because, the more you have gratefulness for everything that you have, things will become more satisfactory. Whereas, like you said, the type of society we live in today, a lot of things, even though you chase them, once you have them, they're not as satisfactory as you thought they would be. So yeah, it's a hard thing to develop though. So
Definitely.
It takes time. But yeah, if we can try, then it's good. Okay, Badriyah, what's your thought for the week?
I guess mine sort of follows on from what Lamisa was saying about gratitude. So something that I wanted to add to that was also just sort of making things easier for other people, and doing small acts of kindness. I've got a little story, but we were raising money for Ma this week, and I collected these Krispy Kreme donuts. So I was carrying 10 dozens for Victoria Station during rush hour, so it was crazy, but I had to collect a few things from WH Smith as well. And when I went there, it was quite empty, and there was just one woman on the shop floor, so it was about 9 a.m. And she was such a cute woman. I was just going to her and I was like, oh yeah, can I just buy these? And she was like, oh, you've got a lot of donuts there. What are these for? So I was telling her about how we're raising money and everything, and I'm taking it back to university. And she was like, oh, do you go to Imperial? Because it's the closest one there. And I was like, yeah, I do. And she was telling me about how her son went. And we were having this whole discussion about how, so her son did civil engineering. And after a couple years, he dropped out because it just got really hard for him. And she was saying how all of her friends were saying, you must be so disappointed. And she was like, no, because he dropped out for himself, and he did that because that's what makes him the happiest alive. And I feel we always get a lot of parents get caught up in they want their son to do this, they want their daughter to do this, without realising that they're compromising their children's happiness. I mean, my parents didn't want me to be a doctor, they wanted me to sort of do teaching, but then I had an open conversation about sort of doing medicine and everything, and they were really supportive, alhamdulillah, afterwards. And it's really sad when parents aren't like that. But anyways, we were having this whole discussion, and she was really open-minded. So she had, I think she was European, because she had quite a thick accent. But even then, whenever she was trying to speak and get her words across, I was like, oh, bless her. And then she was so after I went, she was saying how she was really craving a donut. And I was like, oh, sure, take one. She was like, no, keep it for your fundraising. And then I was like, you know what, this doesn't sit right with me. So then I went back to Krispy Kreme's and I bought her a little donut. It was Valentine's Day as well, so they had the cute pink ones. So I wrote her a little message and everything. And I was like, me taking those 2 extra minutes to get her a donut and sort of write the message would make her entire day. And that was my thought process behind it. It's not sort of taking away from me in that day. So I went back, I gave her the donut and everything, and she was nearly in tears. She gave me a hug and everything. She was like, oh my god, you made my day. I'm looking forward to having this.
That's so cute.
And it literally fills you with so much joy when you do something for other people. But yeah, I guess that's my thought of the week.
That is so
That is the nicest, most heartwarming story we've had on this show. And she's so right. 2 minutes out of your day will really make someone else's day. Even giving up a seat on the tube. I feel like I've talked about this so many times, but when I remember one day I came in on the tube, and I had so many bags because I was coming from Luton, and this man, he got up and he gave me his seat straight away, and I was just like, that is the nicest thing anyone could ever do. And I'm like, you don't have to do that. You very much own that seat, you sat there, it's yours. But those small acts of kindness go a really long way in someone's day. So yeah,
I feel like you forget when you do these small acts. Next year you're not going to really remember that.
Yeah.
But for that person, it's very something that they will remember for a lifetime. So doing acts of service is really, really important, and that's why we're going to talk about more today.
Yeah.
I think going on the point as well about the person that you're speaking to and how she stuck up for her son is really, really important. And I think I can understand why parents, especially from a minority perspective, why they want their children to go to certain careers. It's because it's a sense of stability.
Yeah.
And they didn't have that sense of stability, or they didn't have that sense of aspiration because they came from certain countries and they had to survive. So I do see that perspective. However, I think like you did, you had an open conversation with your parents. You told them that you want to commit to this. You have a purpose, and this is where you see yourself. I think that's where we kind of fall short. We don't have that open discussion, and that's what they want to see. They want to see what you're envisaging. So yeah,
I think also this idea of it's not a disappointment because of the fact that he's going for his own happiness, especially in medicine as well. I feel like we're in a career path where you kind of have to strive for the best every single time, and it's almost like that's expected of you. And I think what I'm coming to terms with now is I don't have to be the best. And frankly, if there's something that I don't want to do, it's okay to take a break. It's okay to stop. It's okay to look at other things and other career options. Life doesn't have to be one big race. You can chop and change, and time is like continuously going. So it's not something like we have to stick to one path and make all these decisions early on and go down it. You know, if you decide to drop out of university because you have other things that make you more happy, that's completely your choice. And I feel like society needs to kind of change for the better in that way. We need to accept a bit more fluidity in people's life, because life is like that. Things change. So yeah,
forget the whole what would they say, just concentrate on yourself and what's good for you and your goals.
Definitely.
Yeah, I remember like someone saying comparison is a thief of joy, and it's so true, because especially in med school when it's so competitive, you're always comparing yourself and your studying habits to everyone else. And it's like sometimes it's okay to be different. Like throughout first year I was constantly thinking, this person is doing an Anki deck, this person is doing this, maybe I should do that as well, but none of those worked for me. So it's really important, like, when you take a step back and just think what works for you and like what you should do.
If notes have worked for you all this time, you can make notes. It's fine. I feel like I tried to stop making notes last year because everyone said it's not effective, but it's effective for me.
Yeah, same.
So I've started making them again. But yeah, okay. I guess that brings us to the end of our thoughts for this week. Thank you all. So now we're going to move on to our hot topics, but instead of hot topics, we're going to do the freshly grounded cards because I feel like they open up good discussion. So yeah, and we can get to know Badriyah a bit more as well. Okay, so first question we're going to go for is, which one should we go for? What do you know now about yourself that you didn't know when you were younger?
Well, I think that's a good question. It's so funny because like within Ma, everyone calls me like the baby. So it's like, oh, when you were younger, that's like when you were a baby. What do I know about myself now that I didn't when I was younger? I think for me, it's how much I like doing lots of different things. So whenever someone sort of sees my schedule, they have a heart attack and they're like, there's no way you have 24 hours in your day. But for me, it's like, I'm those people that can't relax. Like I constantly need to be doing something. And I feel like when I am relaxing, it's a wasted opportunity. And I can see how toxic that mindset can be. Alhamdulillah, like up until now, I've managed to sort of sustain it. But when I was younger, I always used to look for the easy way out. So it's like, okay, I can sort of do the bare minimum and get through. But now it's sort of just taking a step back and thinking, why should I do the bare minimum? And even when it comes to like university, a lot of like older years have said, if you graduate with just a degree, you've done university wrong. And I feel like I took that very literally, and I was like, okay, you know what, like any opportunity that comes my way, I'm definitely going to take it. But alhamdulillah, I feel like it's made me the sort of person that I am now. And yes, I think like that's probably the one thing that I've learned about myself, that I like being really busy. And it's okay to sort of relax in different ways than like other people.
I like that, especially in the first few years of university. You want to try everything so that then you know what you like and you don't like. And actually you can look back and you can be like, yeah, uni was good. I tried loads of other things. That's good. What about you, Mariam?
I think when I was younger, I had I lacked a lot of confidence. So I think it would be potential. Like I didn't know I had potential until I went to university and I tried so many things. And I feel like even radio has elevated my confidence to the nth degree, really. And I also really enjoy advocacy and representation. So that's kind of my career trajectory that I took. And I really became passionate about widening participation. So when you mentioned about doing the program at King's, I was just like, okay, it's really good. And I think that's something for me specifically. I like to be a facilitator. So I didn't know that when I was young. I really liked to be in leadership roles, even though I had very low self-esteem. For some reason now, I really like to be in roles where I'm facilitating change. So I think that for me is something that I've learned. I'm kind of still discovering as well what I'm interested in. But I feel like now I've come to a point where I'm okay with the fact that I will evolve and I can embrace different kind of routes.
Wow. Very nice. Vereen?
I think it's still like a mix of both of you. So when I was younger, I think I didn't think that I was capable of doing the stuff that I'm doing now, and that's because I lack confidence like Mariam. So I wouldn't think when I was, I don't know, like in year 7 that I would be on radio, that I would have, because I always wanted to speak my mind when I was like in high school or something, but I never really did it because I lack confidence like Mariam. So yeah, just a mix of both.
Nice.
Go on, let me start your turn now.
I think I didn't know that I would end up with a career in science. I very much thought I would be more along the humanities route.
Oh, really?
Yeah,
I always saw you as a science person.
Yeah, you wouldn't see me as a science person.
No, I do.
Oh, you do? Oh, yikes. What does that mean? Anyway.
Two meant to do this. Yeah, let's be careful.
Yeah, no, I don't think I ever would have pinned myself to have a career along this side. I was always more interested in like humanities and stuff, but I'm grateful for it. I'm happy for it, and obviously I chose it. So.
I feel like we tend to think in binaries. If you're interested in medicine, you can still do a radio show. You still can have other interests, and I think that's something that curriculums don't teach you. I think you really need to be able to think about how you can expand your opportunities. You
it's
can have
flexibility
more than,
again, isn't it?
Yeah, you can have more than one interest, and that's completely fine. You don't necessarily need to have an interest that's related to your degree. It's completely fine to be thinking about other things, and I feel like that actually makes you learn more. So that's something that I'm really passionate about, especially because I was a widening access officer. I used to always try to tell students that discover yourself in different areas. You don't necessarily have to have one idea of thought.
Yeah, I think it also makes you like a more interesting person as well.
For sure.
I know that when I was applying for medicine, I was so scared that like going to Imperial is just going to be a university of nerds, and like it's just going to be because it's a science and STEM university. I was like, oh my god, like everybody's going to be so boring. So I was like very like set on UCL, and only like in the last minute I was like, you know what, like even if I just compare my friendship group, we're all like into STEM, but we have our own interests and everything. And now, alhamdulillah, like I feel like it was definitely one of the best decisions that I made. And you meet so many new people, like even though you guys have the same passion and you're going into the same sort of career almost, you meet people from like completely different walks of life, so many different people that have like crazy interests and everything.
Okay, so on the flip side of that, let's go with this one. Finish the sentence. When I'm double my age, I would like to be
a lawyer.
A lawyer. Very nice. Yeah. So she's got a career goal in plan. Does anyone else have anything different?
I'm just going to say content. I really want to be content with wherever I am in my life. And when I'm older, I just want to be content and with what I have. And I want to be content with the decisions I've made, or even the lack of decisions I made. I want to be content that this is what Allah decreed for me, and I just did my best.
I think I agree with you, Mary. I think that's the only thing we can really wish for.
Yeah. I had to do like the maths in my head and think, how old would I be when it's like,
please don't.
40s, 50s. I think I agree with you, Mariam, as well. But one thing that I also want to do is have made an impact. Because I feel like, I would be about 40. So I would have hopefully had made an impact through med school, through sort of starting my years as a doctor and stuff.
Inshallah. Yeah, I think I'm going to steal hers now.
Okay, all right. And then kind of a more easygoing one. When was the last time you laughed so hard that your stomach hurt?
When was the last time?
Come on, guys. Are we not having fun? I don't know.
Well, I can't remember.
It's kind of hard. I feel like actually we have so many moments where we laugh a lot that it's difficult to pick one, right?
I think like the times when you laugh the hardest is jokes that they're only funny in the moment.
Yeah.
Because like I remember, I think maybe it was Monday, but we have like these study rooms in uni, and you never get work done in the study rooms. It's literally like you say you're going to get work done, but like people come in and you just like have a chat and everything. So like me and my friends, like we just laugh about the funniest things, and it's like when you're friends with someone and you're on the same wavelength as them, so they haven't even made the joke yet, but you know what joke they're going to make. So we just laugh before the joke has even been said, and everybody else is just so confused, like what the hell, why are these two girls just laughing? I can't remember for the life of me what was so funny, but I was laughing so hard that like my abs were hurting and I had to like stand up and everything.
Yeah.
But yeah.
She has abs, girls. Wow.
My non-existent abs are hurting.
We love it. Yeah, I feel like it's those impromptu moments in every day where you just end up laughing super hard. Okay, I guess that brings us to the end of our hot topic / freshly grounded game. We're going to move on to the main topic now. So the main topic is about disparities in healthcare. We're going to try and cover it from a few different aspects. I guess the first thing that I want to ask you guys is that health is considered a human right in loads of different kind of conventions and charters. For example, the WHO Constitution says the highest attainable standard of health is a fundamental right of every human being. It's in the EU Charter of Human Rights as well. I just want to ask you guys, if health really is a human right, why is the access to health so varied across the world? Yeah.
Should we start off with our guest?
So I was thinking about this a lot, like even when I went Bangladesh, and I think there's a lot of different reasons. So it's really hard to just put your finger on one.
Of course.
But one of the main things, I think, is the lack of education. So even in, I can use Bangladesh as an example, but even in like the remote villages and stuff, a lot of the time the education that we get from like a young age here in the UK about like healthy living, lifestyle, switching from like white bread to brown bread, etc., you don't sort of get that in Bangladesh. So all of those sort of conditions, they're just there. Like nobody knows that there's an issue with it. Nobody knows what you should sort of do. And as a result, nobody ever solves like those underlying conditions for a long time. And then as a result, because there's no sort of like education and there's like a lack of like infrastructure and stuff as well, it makes it harder for hospitals to be established so close to like where people live. And then it's that vicious cycle where without education you don't have the right sort of like finances and everything to sort of fund to go to like those hospitals. So I feel like in that sense education is like the core, and I feel like it's one of the reasons why. But it's not their fault. Like, it's not their fault that they don't have, like, a proper education system in place. They don't have, like, access to, like, the hospitals and stuff. Instead, it's, like, maybe, like, the governments and everything sort of focusing on the richer areas and trying to develop them more without realising that on the outskirts, those people also need help. And instead, like, they need the most help. I even remember, like, when applying for medicine, one thing that you learn about is, like, postcode lottery. And essentially it's the people that need the most help are the ones that have the least access to it. And I think there was like a study in Manchester where Greater Manchester had like so many different like tertiary centres for cancer. But then even if you go like a couple roads down to like Trafford, people there who have like lower income and everything, they don't have access to those centres. So I guess it's not only seen in third world countries, but also like on a lower level, it's sort of seen in the UK too.
Absolutely.
Go
ahead.
No, I was just saying that I think it's completely manifested in the UK. You can see those health inequalities, especially in terms of access to health. And I think whilst education is extremely important, and especially it's applicable to third world countries, I think it's about wealth and poverty. And that's something that you can see within the UK. If you live in a remote area and you only have one GP and you have one hospital and you live very far, you will need that money to go to, you need money to go on public transport firstly. You'll have to rely on public transport. And it's more likely that you'll miss that appointment. And so therefore it's a vicious cycle because you're not going to get access to that healthcare. And if you have a job, then you're going to have to take time off. And often people are on 0-hour contracts, so they don't have access to a sustainable amount of wealth. More often than not, they don't have disposable income, and so therefore, if they're not well, they're not going to be able to have a good quality of life, and they're not going to be able to create or generate wealth. So I feel like the inequalities really do come from resources, and I think beyond that, you can even think of in terms of politics. This is something that you can see within the UK as well. What are the priorities? I feel like often the NHS is deprioritised. If you think about, you see a lot in the news how certain pots of money is suddenly appearing for certain campaigns or certain groups, but then when it comes to the NHS or if it comes to certain groups, there isn't enough. There's a cost of living crisis. There's just crises upon crises, and I think that is about priorities, a sense of priorities, and whoever's in authority.
I think it's interesting because we talk about finances and funding, but then we see like developed developed countries, for example the US as well, have huge issues with access to healthcare as well, despite, you know, being one of the richest countries in the world. I feel like it's interesting. It's a balance of everything of what you guys have said. It's a lack of funding, it's a lack of priority, it's also a lack of education as well. And it's a shame, because I feel like actually in areas, if we talk about developing countries, frankly I feel like there's not as much drive to improve those areas. I think that a lot of these countries and a lot of organizations, intergovernmental organizations, large scale organizations, spend, in my opinion, a lot of time faffing. This is the easiest way I can put it. I feel like they focus a lot of time on various conventions and meetings and things like that, but no tangible impact or change is seen. And I feel like, you know, we always, for example, the MDGs and the SDGs, these were set out, these were goals that they wanted to attain, and we never actually end up attaining them. And I feel like we start off with the mindset that we know we're never going to attain them, and that's why they're never attained. It is a right. It is every person's human right. But unfortunately, I feel like, you know, corrupt practices in the world has unfortunately led it to this state. But yeah, this is the end of the first half of our show. Thank you all very much for listening, and inshallah we'll see you in the second half, where we'll continue discussing this topic. Assalamu alaikum wa rahmatullahi wa barakatuh.
You're listening to an Inspire FM podcast, making available our popular programs from our daily broadcast on Inspire FM.
Assalamu alaikum everyone, and welcome back to Sister Speak. Again, you're joined here with me, Lamisa. We've got Fareen and Mariam in the studio as well, and we're joined by our special guest, Badriyah. So before the show, we just started our main topic, basically talking about disparities in healthcare. We discussed the right to health and the fact that it's actually such a multifactorial issue. There's so many things that unfortunately prevent people from having access to healthcare around the world, and it is such a big problem. Do we think that universal, like tools like the Universal Declaration of Human Rights, actually help to address the issue? And is there more that can be done by intergovernmental organisations and governments to improve access? What do you think?
Oh, do you want me to answer?
Go ahead.
I feel like there are human rights organisations out there. I think the declaration was there for a reason, and the UN Assembly coined that in 1948, if I'm correct. Under the Charter 55.
46.
46?
Yeah.
46, under Charter 55. And I think, I think that was there for the purpose to protect people's human rights. But I do think that organisations, for example, Amnesty International, it often is a tribute to advocacy for people's rights in terms of, in terms of the political spectrum. And I think that when it comes to healthcare, I can't think of a organisation that specifically caters to human rights in terms of healthcare. So unless anyone else,
WHO,
yes. But I just feel like in terms of the ground level, so with Amnesty International, if a country is breaking, for example, if they're having a war, if it's a war-torn country and they're breaking war laws? I don't know what it's called.
What do you mean?
So if a country breaks these certain laws, then I forgot the name. But anyways, so if for example, when it comes to Palestine and Israel, quote unquote, if some of the rules are broken in terms of like you're not allowed to bomb schools and hospitals, then Amnesty International will come and make a report, and then that's supposed to be influencing the UN in terms of how they're going to take a step forward. So I feel like in that you see that organisation should be quite robust, but in terms of who, you did see that through COVID and the recommendations they made. But I do feel like these organisations, whilst they're proactive in terms of trying to create this impact, I don't think it's transcendent as much as it should do in terms of political change.
I agree. I feel like there's a lot of bureaucracy, in my opinion, that prevent a lot of the good work that's happening from progressing any further. I feel like in years that have happened, so we're in 2023, I feel like by now people really should have at least basic access to healthcare all around the world. If we go to resource poor settings, like you were talking about Bangladesh earlier, certain areas of Bangladesh, certain areas of Africa, even South America, we go there and it's almost like you've gone back in time because of the fact that they have such little in terms of healthcare, in terms of other resources as well. It shouldn't be the case, frankly. Especially with the amount of money that goes into funding these organisations and the amount of money that they have. I feel like a lot more can be done in terms of doing bottom-up projects, actually going to the ground, actually thinking about long-term solutions and short-term solutions. So I know we'll talk about more later on, but in terms of educating public, like Badriyah said, it's so important to ensure sustainability of the projects that you're doing. Because education is one thing that changes attitudes, and then that lasts for generations on end, and that is what truly drives development. Whereas if you're just chucking money at various different organisations and expecting things to change, it's never going to change. That's my opinion anyway. But yeah, Badriyah, Fareem, what do you think? Do you think that intergovernmental organisations could do more?
Yeah, I mean, I feel like sort of just having those policies and everything in place isn't enough, because you can sort of say all of those things but not sort of chase up on them. So even when it comes to like the access to healthcare and everything, I feel like it's easier said than done. And even when you sort of see it on the ground, like, and there's nobody sort of chasing it up on the ground, you can't ever sort of truly implement it. So I feel like building that infrastructure is really important. And sort of having more like rigorous policies and stuff in place. Like even in Bangladesh and like private hospitals and stuff, they try to sort of do more C-sections because it's more profitable. But there's no sort of like stopping it. Yeah.
So you mean like auditing teams, checking teams, just to make sure that everything's being done properly?
Yeah.
And I feel like that's the thing with the Bangladeshi healthcare system as well, because I did a bit of research on it myself. And I think the thing with them is they're very fragmented. They have loads of different departments which don't necessarily talk to each other. And looking at the research, there weren't as many regulatory bodies to kind of make sure that everyone was doing their job as they were meant to do. And perhaps that's one of the reasons why it's not working as well as it should, which is a shame.
I think also, sorry, go on, Farah.
That's okay, you go.
In terms of data as well, so just because we had a show with Muslim Senses as well, so it kind of really opened my eyes, especially in terms of our community, coming from a minority community. I don't think there's enough data surrounding the issues that we face in terms of the inequalities
that we face in the UK.
That we face in the UK, for us to be able to enact change, because policies are informed by data, and so if you don't have the data that is reflective of our community, then it's very difficult to advocate for our needs. So I think data is really, really integral in terms of trying to mitigate this gap.
Okay, I guess taking the discussion from a slightly different angle now.
Farah wanted to add.
Yeah, I just go ahead.
I just wanted to say that with organizations, the thing is that they promise a lot of stuff and they try to get all these people to donate money, but they don't actually use it effectively. And like you said, the work that you can see that it's not effective.
Okay, so thank you for that. In terms of the next question I want to ask you guys, is kind of looking at disparities in healthcare in terms of gender differences. So impacts of COVID-19 have been discussed massively. We know that there were so many different impacts, economically, health-wise as well. But I feel like I didn't really see it being discussed in terms of the effects that it has had on women's health. So this is from an article from the World Economic Forum about why we need to prioritise women and girls. So during the height of the pandemic, funds were directed away from women's and girls' health towards other life-saving services. There was also a lack of awareness and prioritisation. This has led to major funding gaps in women's healthcare. In addition, an underfunding of women's health research means that specific challenges or diseases that affect women and girls remain unaddressed. And according to a report released recently by the UN, nearly 50% of global pregnancies are unintended, 60% of unintended pregnancies then end in abortion, and 45% of all abortions are unsafe, leading to around 5 to 13% of maternal deaths. I mean, this is just from one article reporting on all of these different issues. Why do we think that women's health is kind of glossed over in many aspects? And I guess, what are your guys' experience with women's health as well?
I think there's kind of a taboo on, is it pronounced that taboo on women's health. So when I went to India, for example, you go there and my cousin, she got sick and she was just, nobody really looked over her. No, there was no, let's go to the doctor, which is something that we honestly take for granted here, that we're sick and we just, we'll take you to the GP, but it's not normal there.
From my experience as well, I feel like there is such a lack of research on women diseases, and because of that, it's so difficult to access healthcare, and especially from my experience as well. And beyond that as well, I think she mentioned about the education. I think even when you come from communities that have some sort of conservative outlook in terms of women speaking about certain conditions, it's quite difficult to speak up about it and therefore to access those healthcare. Especially in terms of menstruation, I think a lot of communities don't like to talk about it, and so if someone is experiencing severe symptoms, we're just told that it's normal, but when really in reality it's not, and it could lead to the consequence of something that's really dangerous for a person. And I think that it's really important to have these kind of conversations on platforms like this to address it, because a lot of the times women don't know that they're having these issues, and so therefore if they don't know how they're going to even put themselves forward to the GP. So I think those two 100%. Kind of elements are really important.
Yeah, like with menstruation is just such a thing that is so hidden, like it's something that's not normal. And I remember they give it to you, like you buy it and it's like rolled in a newspaper, which is like, and you have to keep it in your bag, and that's how you take it. So there should be like a bit more, that's normalized
about the topic.
Yeah, I think there's like two main points I want to add. So firstly, like about the whole taboo aspect of it, I feel like menstruation and like maternal health and everything is something which people don't want to talk about. Like it's sort of embarrassing almost, and especially from like the community that we're from as well, where people like it's just like on the sly, like everybody gets really shy when they talk about it and everything. Alhamdulillah, like I went to a girls' school, so the conversations were a bit more open, but even when it came to things like showing how pads work, how tampons work, they'd always like use like blue coloured water instead, so like it's not too embarrassing and everything. And it's like, why do we need to do that? Why can't like me talking about my broken leg as open, like why can that not be as, why can me speaking about like menstrual health and everything not be as open as that sort of thing? And the second thing that I want to talk about was like, I remember reading an article, and it was saying how 70% of those affected by chronic pain conditions are women, whereas 80% of pain research is conducted on males. And it's crazy because a lot of the sort of research that goes into medicine and stuff is focused on like your white man sort of thing, but there's so many more people, even like textbooks and stuff. Like when we study anatomy, it's so hard to sort of find like a female body, and it's almost revolutionary when you find like a female anatomy model. So I think it's just crazy how sort of narrow medical research and stuff is, and luckily now we're sort of like opening it up and everything a bit more, but I feel like those sort of discrepancies have like risen because of the lack of research into women and the people that are actually being affected.
It's a huge issue actually, and it's not just it's like all across medical research, but also conditions as well. A lot of the symptoms that they will describe are symptoms from males. For example, heart attacks can present so differently in women than they do in males, but we get taught a very specific kind of set of symptoms for a heart attack. So it's quite dangerous actually, and what Mariam, you said is completely true. If we can't talk about it and if we don't know, then how do we know when to then go seek help? And then it's amplified in countries where perhaps education isn't as open in the first place anyway. So yeah, it's a big issue, and it's a shame. But yeah, so we've talked about, education, how important it is. I guess this is along the lines of my next question. What are some sustainable methods to bridge the gaps in healthcare access, but also bring about importance to women's health? So this can be locally in our local community, it can be nationally or internationally. So yeah, what do you guys think? Do you want to go?
So I can speak a little bit about what MAR does, and how we're sort of working towards making the work more sustainable. So our vision is to sort of have this one MAR model where we have different sort of women's groups that represent sort of different women in different areas, and we call these sort of like spokes, where they get their antenatal checks, they get like the education, and that's based off the understanding that once you educate one woman, she's going to then spread that education to other women in her community and her daughters are going to then pass it on and continuously do that. Because if we just give them the medication, it's supported that one pregnancy, but that's it. It's not sort of like going on for life. And essentially that way, when we sort of like once we sort of like implement this, hopefully like if there's any red flag symptoms or anything, we can then sort of refer them to like tertiary centres. So this is what we're sort of trying to build. One of the other sort of models is an app. So it's the Gravida app, because one thing that was sort of identified was there's no central data, there's no sort of database for these women. So like in the UK, where if you have certain risk factors, you're looked at a bit more during your pregnancies and everything. But in Bangladesh, they don't sort of have that. So the Gravida app is literally just a database for all of the women that come to the healthcare, that come to like the health camps and everything, asking them questions like, what pregnancy is this? Is this their first pregnancy? How many pregnancies have they had before? Any complications before? And then categorizing these women as like red, amber or green. And then looking at these women in the red category and thinking, how can we then make their pregnancies a bit easier and stuff? So I feel like that's a few steps that Mai's taken through making it sustainable. And not just sort of looking at the women, but also the girls as well. So we have like a project called the Period Poverty Project. And what we're trying to do now as part of the outreach team is link UK schools to schools in Bangladesh, in Pakistan and in other areas. So those schools in the UK, they can sort of like raise money for like the pads and the sort of like sanitary products for the girls back there. But I feel like one thing is with period products, especially for like the disposable ones, is that you just give it to them once and that's it. Like you can't keep providing them pads. So instead we give them reusable pads so they can last up to about 2 years. So it comes in like a pack of 3 and like 2 for the nighttime as well. And that ways when we provide those pads, we also give them like education because they're taught like wrong things almost. So things like, oh, don't eat this when you're on your period, don't eat that when you're on your period, and as a result it just makes the girls weak and they don't, and again because it's a taboo, they don't know like how to deal with their period. So as a result they don't go to school because they're in so much pain and they're scared that they might leak, and then because of all of those missed days in schools they don't sort of have the right education to carry on in the next step of their career, and then you're just sort of stuck in this vicious cycle again. But yeah, so that's like a little glimpse into like what Ma does for like the different aspects.
And I think it's organisations like Ma that really help to kind of bridge those gaps. I guess that's kind of the main point of our show today, is to discuss how we can bridge those gaps. And it's relying on the work that people at Ma do every single year to kind of help boost that sustainable development. I feel like those are the types of initiatives, for example, the reusable period pads. I don't know why I'm losing my voice. The reusable period pads that, you know, is going to go a long way, and the education as well. I mean, we've talked about the importance of that. I mean, what do you think, Mariam, about all this?
Yeah, I think it's really important to have a long-term kind of vision and to ensure that it's sustainable, especially in terms of the education. I think that's a really important point, because if you are missing school, then it's going to impact your attainment. And if your attainment is impacted, then your career progression is going to be impacted. So having that sense of education and even just instilling this attitude that you can speak about your menstruation and the impact of it and how you can deal with it is really important. So it's really good that Ma is kind of implementing this, and I urge everyone to support Ma in terms of trying to create the sustainable model.
I mean, very quickly, what are a few ways that people can kind of check you guys out? Maybe some socials?
Yeah, so we operate the most on our Instagram, so at @marglobal_. And there we post like the different events that we have, the different projects that are going on, and that's where like most of the information is.
Yeah. Perfect. Okay. And I know Ma do a project every single year called Journey Ma. So do you want to speak a little bit about Journey Ma and kind of what your experiences were, if you have any particular memorable ones that you want to share?
Yeah, sure. So Journey Ma, when I describe Journey Ma, I'd say it's a sort of opportunity of a lifetime. You go there and you come back as a changed person because of everything that you saw. So for those that aren't sort of aware of what Journey Ma is, Ma take a group of like about 20 people from the UK to Bangladesh and sort of show them the work that Ma is doing on the ground. And the aim of this is to not sort of volunteer and to not sort of like help out in the camps as such, because the Bangladesh team sort of have that under control, but it's to sort of collect stories of these mothers and then share it when you come back. And I think Journey Ma had definitely sort of like, it did that for me. One story that I'd say hit me the most was when we went to visit the hospitals. So in Bangladesh, they've got different types of hospitals. So they've got the government hospitals, which is for like the poorer people. And then they've got the sort of like more middle ground hospitals and stuff, the private hospitals. And then they've got like the hospitals for like the big people. So we went to see a government hospital first. And when we went to the government hospital, just before we went, there was like a huge sort of, there was like a thing that happened, like an incident. I can't remember exactly what it was, but it led to a medical student being killed because of an accident that one of the other doctors had made. So already the security and stuff was like quite tight. We went there, and as soon as you sort of go in, you see, like, I saw a woman that was just crying out in pain, and nobody was sort of batting an eyelid. She was crying and crying and crying. Her husband was using like those fans to like cool her down because there's no AC or anything. And we just sort of carried on walking. And then we went to the labour observation ward. And usually in the UK, you sort of like separate the women on based on the different parts of pregnancies that they're at. But this labour observation ward had women that were just about to give birth, women that had given birth, women that were still in labour and stuff. And when you walk in, you sort of see beds in the room, and it's like 2 women per bed. And then there's like other women that are sort of like fighting for floor space. And it's so crowded in there. And I was literally shocked because comparing it to like the hospitals in the UK where women are sort of like, they're complaining that they don't have like a comfortable pillow or they want like another blanket and stuff. But these women are happy with just getting like a tile on the floor to sort of like sit in. So I was speaking to one woman in particular, and her daughter had just given birth, and her daughter was sort of just like sleeping and stuff while the grandmother was looking after the baby. And we were asking her like, oh, how come she's so tired and stuff? And she was saying how in Bangladesh, one thing that is taught is during your pregnancy to not eat a little bit. To eat a little bit, because if you eat less, the baby comes out a lot easier. So this woman wasn't eating much during her pregnancy, and as a result, she was so weak that she couldn't even produce any breast milk for her baby. So because she couldn't do that, she had to buy formula milk. And formula milk in the UK is already expensive. So imagine for Bangladesh. So when she gave the milk to the child, she gave like such a little bit of powder and gave so much water, so it was literally just almost like tinted water. So the baby was just vomiting it all out. And it's crazy because the grandmother doesn't know what to do. She can't afford anything. The mother is sort of still recovering from such a horrendous sort of childbirth and being so weak that she can't even recover. And the thing is, it's almost the norm. And what I find so crazy is when you tell someone in the UK that you're pregnant, everyone's so happy for you and they're like, oh my God, like your family's going to grow and everything. But in Bangladesh, for these women, especially in the hospital, it sort of seemed like a burden. And they were like, oh no, like now another child that I'm going to figure out how to sort of support. And it's crazy just seeing the difference. So that was like one of the main stories. And like a shorter, smaller story is like in the camps. So I'm from Mali Bazar, and everyone sort of like jokes about how people from Mali Bazar are like really posh and everything. So when we went to one of the camps there, I was expecting like a different story almost. But it was sort of the same thing there. And there was one dad who was holding his child, and you can tell that his child sort of had a birth defect just by sort of like looking at him. And we spoke to this dad, and he was saying how when his wife was giving birth in the government hospital, the doctors had to attend to something else as well because they were so like sort of overcrowded, and as a result the baby was lacking oxygen. And then when it was born, because of that deprived oxygen, it had so many other sort of issues with it. And now the dad wants to prevent this for next time. So he's sort of saving his life savings for his wife to go into a better hospital and to go into a private hospital. The private hospitals aren't even like NHS level. There's still like a lack of sanitation and lack of hygiene and everything. And the crazy thing is like it's almost like £10 to £12 to sort of sustain a pregnancy, but that's his life savings. And it really puts into context, like, we probably, like, £10 to £12 in a day is, like, amazing for us. Like, we saved a lot. But for him, like, that's how much he's been saving and how much he's been working towards, almost. And when we asked him, like, also, do you want a son? Do you want a daughter? And he was like, I just want a healthy child. And it's just so crazy that they have such low sort of wants, but even then it's so hard to grant this for them. And that's when I realised why the work that we're doing for MAT is so important, because we're helping so many mothers there. And the same way where we love our own mothers so much and we do anything to sort of support our mothers and like all the sacrifices that they've made for us, by supporting Ma, you're also supporting other people's mothers who are the most closest person to them. So I feel like that was like, those two stories were like the key drivers to me sort of being in Ma and carrying on with the work that I do, and like putting in so much effort to make Ma so big and like a household name almost.
It's
So touched.
It's actually incredible work when you think about it. And she's talked about the different aspects, the fact that you're helping other people's mothers, but also these people really don't have a lot, and the effects of a pregnancy for them are in so many different ways. Financially, the burden on their household, the burden on the relationships they have in between their families, and then having to deal with these pregnancies and these babies that, you know, may end up having health issues because of the lack of care that has happened, and then having to deal with that. In the UK, it's difficult as well. There's a lot of support available, however, whereas in Bangladesh they don't have anywhere near as much that support, and it just goes to show that the work you guys do out there is so amazing, and every single, you know, kind of effort towards that cause goes such a long way to help all these mothers. And I'm glad that you were able to come on our show today and kind of share that, and just kind of remind everyone about the importance of this particular type of cause, because I feel like actually Ma is going for such incredible change, and yet, you know, so many people are not as aware about it. So yeah, if you are listening to the show for the first time, please do go out and check Ma at Ma Global on Instagram to have a look at the amazing work that they're doing. Any thoughts from you guys on any of that?
I just hearing about it, it hurts so much. I can't even think how they watch it in person and see those mothers. I could never do it. I don't have the heart for it.
And we pray for all the mothers out there, and we support Ma on all of the amazing work that they do. Inshallah, I'll be going in the summer as well, and hopefully having that experience myself. But yeah, I'm looking forward to it. I hope that, you know, it will be a good experience for me to come back and kind of reflect on some of the things that I've seen, and it can change the way that I actually kind of have an outlook on towards practice. And then hopefully in the future, maybe one day I'll be able to go over to Bangladesh and practice there as well. I feel like, you know, they are the people that need help the most. Yeah. And every single person that we can help, you know, it makes such a huge difference. Even the tiniest bit of help makes such a huge difference. But yeah, thank you very much, Badriyah, for joining us on today's show.
Thank you for having me.
We really appreciate it. So yeah, thank you all very much for listening, and inshallah we'll see you next week for another great show. Assalamu alaikum wa rahmatullahi wa barakatuh.